So this is a little bit about me. So I've been a doctor for 25 years, and I love it. I wouldn't change my specialty anytime. My first 12 years, reconstructive plastic surgery and burns. Always wanted to be a dermatologist, but got my hands on the scalpel, never looked back since. But I spent a lot of time in plastic surgery and reconstructive burn surgery, from pediatric to adult years. So it was during this time, especially doing skin oncology, which we all have to do in plastics, that it taught me a lot about two things. Firstly, you need to understand the patient. That's a given. But I believe in the restoration of functional skin, but everybody wants a desired aesthetic outcome. And the whole thing goes over and over and over again, from pediatric life to adolescent life, and then to later life. So that analogy stays through now in my new life as a cosmetic doctor. But I talk about transitions a lot. And today is all about maybe thinking laterally, but also thinking about how we're going to evolve in our field of medicine, dermatology, plastic and reconstructive surgery. Because I came into my master's a few years after my NHS work, I wanted to learn something new. So I picked a topic out of the blue, light therapy, PDT. What is it going to do to skin? I knew nothing about it. So I knew many of you today also have said, I don't know much about this topic. So I learned very quickly in my master's that you could use light and you could stimulate things to naturally, autologously wake up the body to renew, revive, reinvigorate, as well as to restore and regenerate. So that ignited something new. So with that in mind, I left my old speciality with my parents' blessing. I said, do you mind if I left the NHS? And they said one thing, do what you want to do in your future career, but just remember this, always remember to practice medicine. And that was it. So here we are, 12 years down the line, got so many new things in my clinic, and I wanted to share with you something new, which is this product, which I felt on my skin 12 months ago, exactly this time. Freezing cold winter in the United Kingdom, as you know, always gray, always raining, and everybody's exhausted from Christmas, overwhelmed, tired. And I put this on my skin. I've only got one skincare line in my clinic for the last 9 years since I launched in Beaconsfield, Buckinghamshire, 9 years. And I've learned it well. And it's a plant stem cell line. And it works. There's clinical data, robust. So when I felt this on my skin in February last year, I thought, there's something here. It felt great. I didn't go with the smell. And then I looked at the data. Wow, something in here. Didn't know anything about it, but it stood out. So I look forward to sharing that with you today. And then the most important thing that makes my decision process, I met the team, Dr. Rob King, and all of the UK team, and I thought, there is something here. This is someone that knows the clinical work, the legacy, the expertise, the 20 years that has gone behind the creation of this formula. It didn't come overnight. So this is nothing new. So I was excited when I met this person, and now I get to meet the rest of his team as well. So I'm excited to share that with you today. So in my clinic, I'm an NHS surgeon. I love facial injectables, but I also specialize in all things non-invasive, regenerative for skin, face, scalp, and bodies. So with my injectables, I've got EBDs, I've got lasers, I've got high-tech facials, which I love. And I've essentially created my clinic for me. So I get done. So here we are. We talk about regenerative medicine. We talk about inflammaging like it's a new thing. But guess what? We've been practicing regenerative medicine for centuries. I've been practicing regenerative medicine. I really should have been practicing regenerative medicine since I hit my teens, because I started inflammation. I suddenly had hormones. I was producing a lot of oil. I started breaking out. So I should have been regenerating myself back then. So really what we're looking at now in our mature years is to do something that's going to regenerate our human tissue to establish normal cell function. Normal cell function, that is a big word. So I'm going to talk about the role of these in obviously managing inflammation, but I'm going to cut my talk into what these exosomes are, what EXO is, how they work, how they benefit, and then my decision to what I call go green. But I've gone green back in 2015, so this was a natural evolution for me, and then I'll go on with my slides and my case studies.